The story of Pippi Kruger made news headlines worldwide. The little girl was a victim of a freak accident which left her with third-degree burns over 80% of her body. Pippi is but one of many children who suffer severe burn injuries every year and highlights that each and every one of us should know how to react properly to a severe burn injury.
It's estimated that around 15,000 children are seriously injured every year by burns, not to mention the large number of adult victims. It's important to know exactly what to do to prevent burns and the proper first aid actions when a serious burn does happen. Here today are firefighter Tracy Whittaker, paramedic Craig Wiley, and Dr. Sally Adams, who is a plastic and reconstructive surgeon, who will help us understand how to prevent and treat burns. With burns, prevention is better than cure. We hear of home fires getting started for many reasons, leaving clothes over the heater, oil on the stove. Sometimes people smoke while in bed and then fall asleep. Tracy, what are the biggest causes of fires in South Africa?
Well, I think at the moment it's winter. And if we go to our informal settlements, I would say that people are using candles for lighting. Sometimes they put it by an open window and it blows over. And of course, they're making use of electrical connections, illegal electrical connections, which then would short out, causing a fire. The other problem is heating. It's winter. They're making little fires to stay warm, and that also gets out of control. If we move to our residential areas, I would say once again, heaters are predominantly a problem because we dry clothing over them. And we leave them unattended, and it leads to fires. Another problem would be all our wall plugs, our sockets, we overloaded. And some of our electrical appliances, the cords are frayed and damaged, and we don't notice it, and we go out, and eventually that also causes
So we should
fires.
actually be very vigilant about...
Yes, definitely. We must be vigilant. We must always ensure if we're leaving home, switch all your plugs off, make sure that all your plugs are actually pulled out, disconnected.
All the plugs, every time?
Well, for most of your appliances, like ladies, I know myself, if you're using your hairdryers lead to it, or your cell phone chargers. If you don't want to pull everything out, definitely make sure it's all off.
What's the incidence of burns, Craig, and how prevalent are the various different types of burns?
The most regular burns we see, it's probably water. Little kids pulling pots off stoves.
Splash burns.
Splash burns in the face, on the chest. We see that quite often.
Because the pot handle is jutting out.
Correct, and also the cord, in a study it's been shown up to 92% of our immersion fluid burns is due to the cord of the kettle.
Yes.
The toddler's walking around with the mother or the caregiver in the home and then tugs on the cord, and that topples down the kettle.
Remember these important tips to prevent a fire in your home. Be careful when making use of open flames and candles. Use heaters correctly and don't dry clothes or other objects over the heater. Take care of your plug points. Don't overload them and unplug appliances when they aren't in use. When cooking, make sure your cookware handles aren't over the heat and are also out of reach of small children.
Dr. Adams, can you tell us a little bit about the various types of burns?
Okay, burns can be classified as either first, second or third degree. It's classified according to the depth of the burn.
Yeah.
So third degree would be full thickness burns or your more severe burn.
Yeah.
First and second degree burns are partial thickness burns.
Yeah.
And they're commonly caused by fluids, etc. The depth of the burn is going to determine your outcome in the long term and inevitably your long-term scarring.
Yeah.
So relatively minor burns like first degree burns, if treated correctly, they should heal within 7 to 10 days. And they leave minimal or no scarring if they're not complicated. Third degree burns, for instance, are full thickness burns, and they often need surgery.
How you treat a burn immediately after it occurs has a significant effect on the injury. Unfortunately, people often treat the burn incorrectly, resulting in further damage. This is what happened to TV personality Michelle Garforth Venter.
TV personality Michelle Garforth Venter takes special care when she makes tea, as she was the victim of a terrible accident as a child, which resulted in burn scars she still carries today.
My burn was a third-degree burn, which came about from hot water. My parents were at a party, and I was toddling around, and the kettle had boiled to make coffee, and I pulled the kettle down from the counter over myself, and it burnt my face, and it burnt my shoulder area. And I only have scarring on the shoulder and not the face purely because of how they reacted as the burn happened. And I was wearing pajamas and I had a nylon gown on, and as they took the clothing off, a layer of skin came away, and there was somebody at the party who thought it was a really great idea to put gauze on the burn, which was the worst thing possible because it's hot skin. And my mom said that the skin started blistering through the gauze, and so they ripped the gauze off, which of course pulled more skin away, and that's why, thank heavens, the scarring is only on the shoulder, because that's where the gauze was placed, and it wasn't placed on my facial area.
Craig, how would you have treated this burn?
So the first and most important thing is to remove the person from the agent that's burned the person. Okay.
So it doesn't continue.
Yes. After that, you want to start irrigating or just flowing tap water over the affected burn area. That you want to do for about 20 to 30 minutes until you actually see that blistering forming, until the burn sensation for the patient or for the person has actually subsided. After the blistering has formed, we want to apply a wet dressing or a commercially made up dressing like Burn Shield. And I think we've got one here at the moment.
We do.
Maybe we can demonstrate it on
please.
Tracy.
So you just pretend.
So if we pretend the burn was on the forearm, and we've removed the burn and we've irrigated for about 20 minutes, and we see blistering forming now, we'd open this Burn Shield. The idea is that because it's cooled, it will actually allow for pain relief as well.
So it cools down the temperature in the wound, and in so doing limits the propagation of the burn itself.
Now, if you don't actually have the hydrogel or Burn Shield, apparently you can use cling film.
That's correct. What is quite nice as well is once you've applied the hydrogel or the Burn Shield, instead of using a bandage that will actually soak up the moisture, you use the cling film and just wrap it around the affected area around the Burn Shield.
So the cling film actually keeps
Seals
in the moisture.
And it keeps it clean, which is important.
If I can just add that if you don't have Burn Shield, you can use the cling wrap on its own.
So you actually, after you run it underwater for 20 minutes, you put on the cling film and
Correct.
phone emergency services.
You want to phone emergency service whenever you get a burn that you feel that is an emergency.
You do it immediately before your actions?
No. You want to remove the burn from the person
First, step one.
You start the irrigation under the tap water, and during that irrigation time, it's a good time to actually phone. Which is very nice, is 084124, which is our emergency, ER24's emergency number, has got a medical advice line. So if you want further advice or pre-arrival instructions, they will assist you with that as well. Pre-arrival instructions is obviously where they prompt you on what other first aid you can do before the ambulance arrives.
What are the old wives' tales that people use to treat burns? What should people not do?
Apply butter. Apply any
Toothpaste.
Toothpaste, so your wound can be minty fresh.
Correct. Yeah, that's not a good idea, and it sometimes actually causes your wound scarring.
Correct.
It actually worsens the wound
very
scarring.
important thing is that people tend to want to apply ice or ice water
Yes.
to the burn wound, and that is actually not the right thing to do at all. In fact, ice in itself can cause a burn. We know about frostbite in northern hemispheres, etc. So you don't want to apply ice to the wound. You want to use running tap water at 16 to 18 degrees Celsius.
Unlike Michelle, Lisa Laubscher bears no scars of her burn injury. This was thanks to Lisa having the presence of mind in the moment to take the correct steps after she was burnt with boiling water.
I was 10 years old when I got badly burnt with boiling hot water. I went for a sleepover at a friend's house, and her older sister was boiling potatoes for dinner. And as she was taking the pot off the stove, I walked past her and straight into the pot. The water fell over the left-hand side of my face and all over my chest. I remember I immediately held my shirt away from my chest, away from my skin, and heard someone say, "Jump in the pool." So I ran and I dove in the pool. There were a number of factors I think that helped with my healing. The first one being the fact that I held my shirt away from my skin immediately, and the second being the fact that I stayed in the pool for quite some time and that the burn had a chance to cool down. And the last thing was that my mom was very strict with me to stay out the sun. She made me 2 hats, one for school and one for civvies, and I had to wear that permanently if I was in the sun. Now the event is just a memory to me. I have no scarring, nothing on my face or chest, not even a little bit of pigmentation. It's completely clear, as if nothing ever happened.
Jumping into the pool, that's a very good idea. Craig, what are your thoughts about the action that she took?
Yes, jumping in the pool is a good idea because you're still getting that irrigation with the water that you want to get. There is some concerns afterwards though, like you're now cooling the entire body down. So what you want to do, if it's a surface area on the skin that is manageable under a tap or a shower, that's a better idea. But she did what was best in that circumstance.
So the negativity with jumping into the pool could be hypothermia, losing too much.
And may I add here, especially in children, we've got to be very careful. It is suggested that you cool down for 3 hours. But in children, if it's a major burn in a large surface area, by cooling them down for 3 hours could cause hypothermia. So 20 to 30 minutes is actually the recommended time period.
Yes, what we'll do in our circumstances, we'll actually cool down for about 20 minutes and then make sure that the environment around them is a normal room temperature of about 25 degrees.
So Tracy, the paraffin lamp falls over and actually catch a light. What do I do in this situation?
Well, immediately you must stop what you were doing
Stop.
originally. Stop.
Immediately. Okay.
Yes.
So if I'm tweeting, I must stop tweeting while I'm on
Stop
fire.
tweeting. Next, we are going to drop to the ground.
Okay.
So drop to the
stop
ground.
what I'm doing. I mustn't run around.
You can't run. If you're going to run, you're going to actually fan or fuel the fire.
Okay.
So you stand still, you stop what you're doing.
Because of the oxygen,
Because
so
of
I'm
the-
running. So you resist, even when you're on fire, you resist the
That's
urge
the
to
worst
run.
thing you can do is run.
Okay.
Because you'll actually start burning more.
Okay, then drop.
Drop to the ground, cover your face, and roll.
Okay. There we go. I want to thank my guests for a very informative discussion. Remember, everybody, stop, drop, cover your face, and roll.